Hello, everyone. Welcome to our Mental Wellness Talk. I'm Kirsten Pauly, part of the Lumino Health team, and we are so excited that you've decided to join us this evening. This session is hosted by Lumino Health in collaboration with CAMH, the Center for Addiction and Mental Health, Kids Help Phone, and Unsinkable Youth. Our conversation tonight will focus on how to support family and youth on their mental health journey. And by the end of this session, our goal is to help you better recognize a decline in mental well-being, start those conversations with your loved ones, and know when and how to access help. By tomorrow, you'll receive a list of resources plus a feedback survey. And now your feedback is really important so we can continue to build relevant events like this in the future. By next week, a recording will be made available, which you can revisit, rewatch, and reshare with your network. And to our French viewers, bonjour. You have the option to listen in through live translation with our translator, Sylvie. And lastly, feel free to join in the conversation with our text chat. Located on the top right-hand corner of your screen, we have our community moderators, Riyadh and Charlotte, who will be hosting chat tonight. Now, I'm going to pass it over to Carrie Bradish, who joins us from Kids Help Phone. Carrie will be moderating this really important discussion tonight. Welcome, Carrie. Take it away.
Hi, thank you, Kirsten. My name is Carrie Bradish. My pronouns are she, her, and I'm the Clinical Practice Specialist Team Lead at Kids Help Phone. My team specializes in supporting counselors by providing them training, coaching, and professional development. I'm joining you from Toronto, Ontario, on the traditional territories of the Huron-Wendat, Haudenosaunee, and the treaty lands and territories of the Mississaugas of the Credit First Nation. I'd like to thank these nations for their care and stewardship over their shared land. So, why is this topic so important? Mental health challenges, they don't discriminate. They affect us all, either through our own experience, family member, or a friend and colleague. The good news is that getting help can positively change mental health outcomes. Adults and youth with strong social supports are more likely to report positive mental health. With appropriate treatment and support, most people will find ways to cope and recover. Just like to touch on some housekeeping points before we begin our introductions of the panelists tonight. I'd like to highlight a few things here. Because of the nature of our conversation, sometimes topics can feel challenging or triggering. That's totally okay. If you find you need to take a break at any point, please feel free to step away from the webinar and care for yourself as needed. A recording will be made available in the coming week for all. We also have some numbers here on the screen for emergency lifelines, including Kids Help Phone and Crisis Services Canada. If you are in crisis, please call. Support is available 24/7. Okay, so let's start off by introducing our amazing panelists. With us tonight, we have Dr. Araba Chintoh. Dr. Chintoh is a psychiatrist at CAMH, assistant professor in the Department of Psychiatry at the University of Toronto, and clinician scientist at the Campbell Family Mental Health Research Institute. Dr. Chintoh sees patients in crisis and also provides care for emerging adults and marginalized populations through her clinical roles at University of Toronto Scarborough, Across Boundaries, and the Inner City Health Associates. We've also got Mikaela Brewer, who is a youth mental health advocate as part of the Unsinkable Youth, a mental health advocacy group founded by Olympic champion Silken Laumann. Mikaela is a writer, speaker, researcher, activist, and the author of The Sifting Project, her first novel. She's also a Stanford women's basketball alumni and a former member of Team Canada. We also have Susan Conway. She's a mental health advocate and retired registered nurse with experience working in emergency, ICU, home care, and case management. Having supported a family member with mental illness, she now dedicates her time to patient and family engagement and serves on several committees and research initiatives at CAMH. Please join me in giving a warm welcome to everybody. Right, so to kick off the conversation tonight, I'd like to start with Dr. Chintoh to help us get a baseline understanding of mental health and mental health challenges. So Dr. Chintoh, can you tell us the difference between mental health and mental illness?
Well, thank you and merci, bonjour à tous. Your question, I think, is one that we want a simple answer for, but sometimes it's not simple.
Mm-hmm.
The symptoms, that I, as a doctor and hospital, would kind of sit down and talk to you about and check off and make sure that, that you do have this diagnosis or that diagnosis. Those symptoms, those things that you experience, those things that you feel, those ways that we behave, they can occur on a spectrum, on a continuum. So, if today or this month, Carrie, you are not depressed or anxious, you might still have some of those symptoms. You might feel that way. I feel that way today, with the busyness that was going on in my day. And so I think, that speaks a little bit to why it's been perhaps so difficult for mental illness to take the prominence that it needs to in the medical field, because it's hard sometimes to say, well, are you just worried, or is this disease? And people kind of tend more to the side that, well, this is something that you can control, and so sort yourself out.
Mm-hmm.
But really, one of the things that we notice, so everybody has these symptoms, is essentially my point. But as they are prolonged, as they are more intense, and as they're impacting your ability to function in whatever it is you're doing, in your interpersonal interactions, in your work, or in your school, in the caring that you're doing for a sibling or for a parent, that's where we really start to think that this is in the area of disease, and where we start to think about intervention.
Okay, thank you for that brief explanation. And I'm curious, you mentioned some things where the feelings or the emotions are starting to impact your everyday life. And I'm wondering, is there a way to recognize how someone might be having a mental health challenge?
Yeah, so I think we have a slide. Yeah, there we are. So, and I think we'll get some good examples actually from Mikaela and Susan later, and they'll share kind of their personal observations of their own experiences, which I think is going to be much more fruitful than anything I share with you. But what I will say, we speak about this kind of continuum or this spectrum, and so mental illness kind of holds this category largely because we need to be able to diagnose, to be able to access resources or certain other things, but you can be ill with a diagnosis, but you could also have poor mental health, so worried a lot or not taking care of yourself in terms of your sleeping and your exercise and your nutrition, that kind of thing. Sometimes we don't have any symptoms, but we're not kind of firing on all cylinders. And then the real synergy, I think, is where you're in a space of optimal health and well-being. And that's not saying that you're kind of tap dancing and happy all the time and everything is rosy and nothing bothers you, but that when these kind of insults or these stressors happen to you, that you can bounce back, you can be resilient, you can cope. It doesn't kind of take you out of the knees as some ways that it can when we are unwell.
Thank you for sharing. Yeah, those 2 points sort of really resonate with me personally, experiencing life in a pandemic, right? Not functioning at the way I'd like to be functioning and having issues with sleep and all that sort of stuff. So I'm imagining folks who are listening in might also recognize some of those things in their experience. Okay, and so in terms of mental health challenges, who might be most at risk? Are there certain factors that contribute to these stressors that folks might be feeling?
That's a great question. So the short answer is, we're all at risk, which is not to send everyone into a panic, like all of a sudden this is going to happen. But, kind of the beauty of mental illness is that it doesn't discriminate. But what I will say is that, people will have heard kind of this concept of intersectionality, more and more in these past year. And that's really pertinent here as well, too. And so we're all at risk, doesn't matter who we are, but sometimes the extremes of our age, younger people or older people have more risk for illness. People in lower socioeconomic categories also are at greater risk, and we'll come back and talk a bit more about that. Race has been a massive thing. Our Black and Indigenous Canadians, you can go to anyone and they'll be able to tell you, stories and experiences. And so, being a woman in our society, being a gender diverse individual, or sexual diversity as well, too, these things all put us more at risk.
Thank you. So there's lots of different things that can challenge in our mental health for sure. Just quickly, while we've got the last little bit, what would you say was the most common mental health challenge in Canada for youth or for adults?
So I'm going to give you my personal opinion on this, and I know we'll be able to touch on it a little bit later, but I think the most common challenge is that people don't know where to go or what to do to get and I always put this in quotations, kind of the help that they need. And that I think is really difficult. Part of our system does it really well, but part of our system isn't structured to give people the help that they need. And for me, that's one of the greatest challenges here in Canada.
Great. Access is really key, it's sounding like. Thank you so much for sharing, Dr. Chintoh. These are all really important pieces to help us understand our own mental well-being, as well as the mental well-being of folks in our community. So thank you so much. We'll be back to you in a little bit. Okay, so before we circle back to Dr. Chintoh, I'd like to invite our next panelist, Mikaela, to come and speak. Hi, Mikaela. We're so excited to have you join us tonight. I know you've got such a powerful story that you're so generously sharing with us. Please know that you only have to share what feels comfortable to share tonight. But I'm just curious, as an advocate for youth mental health, do you mind telling us a little bit about what your experience has been?
Yeah, for sure. And I apologize if anyone can hear the rain like pounding against my window right now. But yeah, absolutely. So as a very, very young kid, I really struggled with OCD. I was formally diagnosed when I was about 6. And that really haunted most of the things that I did in school and socially. I really, really struggled with it. And my saving grace, I think, as I got a little bit older, was playing very high level sports competitively. And all throughout high school, I was competing in track and basketball. And I climbed pretty high on that ladder, ended up playing for Stanford, and they just won a national championship last year, which is amazing, and played for Team Canada. But I was carrying a lot with me, a lot of struggles with OCD and also some other things that were happening at home at the time. And I think being an elite athlete brought on some new pressures that I didn't anticipate. Performance pressure, some very toxic definitions of mental toughness. And I associated that with my self-worth. And so I think very much when I went to Stanford, I was running away from a lot of things that I was feeling prior to that. And I actually brought a quote that I wanted to read that really sums this up. And it says, when you're somewhere and it turns out not to be the right place, you can always go somewhere else. But if you're running away, nowhere is ever the right place. And so being there, I really struggled. I think a lot of things were compounding each other, be it the pressures of being an athlete or having mental illness. That all kind of funneled into a very severe depressive episode that ended in a suicide attempt. And I was in the hospital for months, missed a lot of my freshman year for basketball. And I think coming out of that, I really was thinking about, the opposite of that quote, like, how do I really sit with what I was trying so hard to run from, and move towards it and heal from it. And I'm still on that journey, I'd say, today. So.
Wow. Thank you for sharing. There's a lot in there. And I have to say, I admire your vulnerability in sharing your story. Thank you.
Of course.
Whew. So I'm curious, what support have you found most helpful, either in sort of the initial stages of dealing with mental illness or sort of now? What has made a difference for you, would you say?
Yeah, really good question. I mean, at the time, in kind of that darkest period, I didn't know what I needed. I didn't know how to ask for it. I didn't have the language for it. And the people around me didn't either. And I think the thing that helped the most was them really just sitting with me, and listening their way into figuring out what I needed. And those people were primarily my teammates at the time. Some of the seniors on the team when I was a freshman are my very best friends today, which is amazing. And I mean, they didn't try and give me advice. They didn't try and solve anything. They really just sat with me and braided my hair and brought me Oreos and pizza because the hospital food was not it. And I mean, some very beautiful relationships came out of that, but I think really just that, like, creating space to feel and to sit with everything, because I didn't know how to process it or explain it to them. And they were patient with that. And that was what I needed most.
Wow. Yeah. So it sounds like just really sitting with you and being with you, and maybe not necessarily saying anything or doing anything super special other than braiding your hair and bringing you Oreos and pizzas, and just listening and waiting for you to take the lead and sit while you process. That makes such a difference. And it's okay to not know too, right?
Yeah, for sure.
Yeah. Well, sounds like you made some really good connections and some good friendships throughout that experience.
I did. I'm very, very fortunate. Yeah.
Same. Okay. And so with your experience and where you're at today, I'm curious, what made you decide to be an advocate for others around mental health?
Yeah, I think it's two things. The first is that, I mean, there's a huge gap in, what science and research in the medical field says about mental health, mental illness, and what is portrayed to, the public, really. I think a lot of that research is inaccessible in a lot of ways. And so my writing and my work today is really trying to bridge that gap of like science communication between research and storytelling, poetry, art, whatever you want to call it, and really trying to connect those two for people, especially in the mental health space. So I was very passionate and motivated by that and studied that in college. And then the other thing is, I think really just for all high performers, and I mean, we all have to perform to some capacity. And this assumption that you cannot struggle with what you're supposed to be an expert in, whether that's an athlete or a student or a mental health care professional. And my eyes were really opened in 2020. My therapist actually died by suicide. And so that really just made me see, like, my gosh, somebody who's supposed to be a professional in the mental health care field can really struggle with this. And I think it goes for advocacy too. This assumption that you're on the other side of some bridge, and like you've made it. And I don't think we ever really make it. I think we're always on that bridge somewhere. And sometimes we have to spend some time in the past, thinking through some things, reflecting, and then also spend some time in the present, being present. And so that really is what motivates me to advocate, I think, for mental health and just well-being in general.
Amazing. It's so important, right? I love that piece around like bringing the information to people in different ways, in creative ways, connecting folks, and really sort of opening up that conversation in places that maybe those conversations aren't necessarily being had. For example, for high performance athletes. Yeah, no, that's really amazing.
Yeah.
Anything else you'd like to share about your experience or why you're doing your advocacy?
Yeah, I mean, I think, one thing I really struggled with, especially as an athlete, is thinking that I needed to be in crisis to seek help. And, I think especially as an athlete, but for everyone, like, you don't have to be in crisis, and you're not weak, and you're not any of those synonyms for weakness, because you need help. And when you are in crisis, I'd also like to take this space to say that mental health crisis response needs to be better, because I don't believe that, the police and like what I kind of went through, having to be put into the hospital and whatnot. And I definitely won't go into details, but, I think that needs to be better. And I definitely advocate for that as well, what that could look like. And there was a really amazing tweet that I actually saw just before I came on here. And somebody said, like, imagine if we were taught like the mental health version of CPR or the Heimlich maneuver. And I think that's so important and such an important piece of this conversation. Yeah.
Absolutely. Yes, we have places to go with mental health support, especially mental health crisis support, for sure. Yes. Thank you, Mikaela. I so appreciate you sharing your experience and the advocacy work that you're doing. I'm sure that by sharing your story here and in other places, other folks will know that they're not alone, and that they can seek out help if they're in crisis or even before they're in crisis. Support from communities and healthcare is super important for all of us. So thank you. All right. I'd like to invite our final panelist, Susan, to join the conversation. Hi, Susan. Now, I know you've got another angle to share with us today. So I'm curious, do you mind sharing your perspective on supporting a loved one experiencing mental health challenges?
Sure. I just want to say there's so much of what Mikaela said resonated with me. And I think what's interesting to point out is, I'm here speaking as a family member, but family is really the community of people who support you. And I think it's really important to point out that can be team members, it can be, friends at university, it can be people you work with. It's really the community of people that support you. So I think it's great to have her perspective on that as well. So I guess what's important for me to talk about, I think, is really comparing what happened, with my brother growing up compared to my son, who became ill with schizoaffective disorder, and the difference between accessing treatment and getting the help you need. So I grew up in a family with, I think, a few members who struggled with mental illness. But when I think of my brother, he was a wonderful, funny, loving person, but he was also a very troubled person and, in and out of a lot of trouble. And unfortunately, he was basically labeled a troublemaker rather than being identified as a young person who really needed help. So, and I believe he was really suffering, and as often happens with people who are suffering the way he eventually started self-medicating. And by the time he was probably about 16 or 17, he was addicted to heroin. So subsequently, the rest of his life became quite tragic. He was in and out of facilities, spent time living on the street, really struggled with his addiction. He did manage to recover for a period of time and had a wonderful family, and that was a very happy period. Unfortunately, it wasn't sustainable for him, and just last year, he actually died of an opioid overdose. And I think part of the reason it wasn't sustainable is because the little bit of help he received came quite late in his life. So, when I thought about having children, I thought about the history that he had, and I thought, okay, I've got to work really hard at this parenting thing and do everything I can to make sure my children grow up in a very stable home and I can give them all the opportunities they need. But eventually my youngest son did start getting ill. And, he was about 16 or 17 at the time that we realized something was up, and it was kind of a wake-up call. As has been mentioned before, mental illness doesn't discriminate. So it can happen to anybody, and there was nothing really we had done to cause it and nothing we could do to prevent it. But sort of the mode we went into is okay, we were successful in raising a wonderful kid. He just happens to have an illness. And we went into the mode of let's figure out what we can do to help. So that kind of started the journey of advocacy, which quite honestly at first was very difficult. I'm fortunate in that I have a healthcare background, so I was pretty good at that, but that's not really fair. Access to care should be available to everybody, regardless of whether you're good at advocacy or not. And the other thing I think was so important is we really set out to educate ourselves on what he was going through. And that was my other children as well. And it became a lot easier for us to have a more compassionate and supportive approach once we did that, because we really did get to the point where we understood just what he was going through.
Wow. Thank you so much for sharing, Susan. It sounds like it's really been a journey for you in learning how to understand and advocate and meet your son with compassion and kindness.
Exactly.
It's amazing. So I'm curious, for those who maybe feel unsure whether they should seek help or support, or maybe there's some reluctance there, I'm curious, what would you suggest they start with maybe?
I think find someone you trust, first off. I would point out that, people have to realize that mental illness is really no different than physical illness. If you have abdominal pain, you're going to reach out to someone you trust and say, oh, something's not right here. And they're going to support you to get the help you need. So I would say, that is the first thing you need, because it's very hard to understand what's going on with yourself. Don't try and understand it. Reach out for help and get some help to find out what the next steps should be. I think once again, when we really understand mental illness, we're kinder in our approach. And I think really we are that train has left the station. I think people are really starting to understand more. And so reaching out for help isn't quite as difficult as it used to be. And I would remind people of that as well. There's people who understand out there. And if I, just to tell a quick story, when my son was first very ill, his first hospitalization, which was really a time of crisis for us. And at the time he was 17, and a friend of his showed up at our door, and he was just a 17-year-old young man, and said to us, I know your son is in the hospital. I don't know what to do to help him, but I would do anything. He's one of my best friends, and I really want to be able to help. So please just let me know if there's anything I can do, and let him know that I'm thinking of him. And then he went on to say, and my family also understands mental illness. We have experienced it ourselves. And they want me to let you know that if there's anything you need, please let us know. And I think something as simple as that is really so important. And I kind of figure if a 17-year-old young man can do that, we can all do that. And I think we're getting better at it. I do.
Absolutely. Yeah. And it's so great that they were able to come to you and say, like, I don't know what to do. I don't know how to help, but I want to.
Exactly.
Yeah. Amazing. Okay. So I'm curious. I mean, you've touched on it a little bit, but do you mind telling me a little bit about why you advocate for others?
Oh, there's so many reasons. Number one, I'm very hopeful that we can change the world for people with mental illness. I think we can make it a more welcoming place if we understand. And, I draw on my own background as a nurse. I've been a nurse, or I'm retired now, but I worked in nursing for 35 years. So, in palliative care, ICU, emerge, all sorts of areas where I saw a lot of human suffering, and I saw a lot of resilience and strength. But what I've seen since I've been involved in mental illness in the last 6-7 years, I think it's really up there with the worst of human suffering and the best of resilience and strength. So to me, it's a big priority. The level of suffering going on out there is something that has to be addressed. And one of the best ways to do that is provide early intervention services to people, and for all of us to be able to talk about it and make it a conversation that people feel comfortable having. So what we're doing even here today, I commend everyone who's here, because that's really the start, just educating ourselves and society at large, not just families. But I think everybody needs to have a better understanding of this illness. And then I think we'll stop tolerating the lack of action from, our politicians and everyone else if we really understand this topic.
Amazing. Thank you so much for sharing, right? That starting those conversations and starting to understand and educate ourselves is super important.
I agree.
Thank you. I'm sure your story and your experiences will absolutely inspire other family members and other folks in the communities just to start that conversation and to start reaching out. Thank you. All right. So now I'll go back to Dr. Chintoh. I'll invite you into the conversation again. I'm curious, can you provide another view from the perspective of a mental health professional on mental illness? I'm curious, what would you recommend we do if we notice concerning behavior changes in a family member or a friend? What are the first steps?
Well, I like some of the examples that I heard from both Susan and Mikaela around these really organic ways of supporting people. One of the benefits of being an expert in this area is that I've learned often that there's not always a method. And, like Mikaela touched on, this is a journey and this is a process. And, I might give you a list of 5 things that you can do, but it might not work in every single person you come across in distress who is unwell. And so with that caveat, what I will say, there are a few things that I will say. So, what do we do if we are noticing behavior changes, emotional distress in people? The first thing, don't take it personally. And I say that kind of from a number of perspectives. I always use the example of a family member who developed psychosis, who had this belief that, one of the uncles was kind of in the basement doing some, naughty things that were, targeted towards her, and was kind of sharing these things. And everyone got so angry. Well, that's nonsense. He wasn't even there. Yeah, we know he's not there, but this is her reality. Like, don't take it personal. Don't get angry about the fact it's not there. This is an example, that she is not well. Don't take it personally. We'll come on to this, I suspect, a bit later around, what do you do when you want someone to get help and they won't do it? And so again, don't take it personally. This isn't about your lack of persuasiveness. This is more about the illness, that you are there, that you are standing by, that you are walking with, that keep your focus there. Try not to take it personally if they don't see that they don't need help, or they don't do what you want them to do, or go where you need them to go at the time, because this is complex and this is difficult. And so, the other thing that I'll say is that sometimes with our illnesses, we don't have the insight to see that we are ill. We don't know all the time that we need help. Sometimes it's kind of a severe illness where what we're experiencing is not based in reality. And sometimes, we do what's natural to us, which is kind of rationalizing it, or, trying to understand it ourselves, or trying to figure out, or blaming ourselves. Well, you're just being lazy. Just get on up and do it, or stop worrying so much, or stop, thinking these things. And we spend a lot of time in that. It's natural. It's kind of part of human nature. But when we are unwell, we can spend a lot of time in that space. And why I bring that up is because, when, as a family member, if you are concerned, or a friend, if you are concerned, and you come here and you say, I think you might need to get some help, you might get some resistance there, and you need to be prepared for that. Let me pause there.
That leads into our question, the next question, but I think that's so important, right? That piece around not taking it personally. I think that's a really important thing to think about. So in terms of what does support look like? What kinds of supports are available to folks once they sort of decide, okay, I might need some help, or I'm looking for some support for a family member or a friend? What's available?
So, a great question. And I touched on it before, and Mikaela mentioned it as well, and so did Susan as well. Our system is not great for mental health care. And those of us who are on the call who have had those experiences in trying to get someone the help that they need, some of us have had not great experiences. And I apologize on behalf of kind of the entire mental health care field for that. And I, for one, am advocating, for some changes. I am lucky to work at the largest mental health and addictions teaching hospital in Canada, where we are trying to be different and trying to do things differently and increase and improve that access. And one of the places to go for support and knowledge very easily from wherever you are in Canada is our website. So www.chemh.ca. And I think there's some information going around, and there's a lot there in terms of resources. And if you don't remember anything, that's a really good place to start. If you're school age, Oftentimes you've got a counselor or a social worker in the school, guidance counselors as well. Find the one that you connect with, find the one that will maintain your confidentiality that you know about, and start to ask questions there. And even as a parent, you can go there and ask questions and say, this is what I'm worried about, where do I go? In the community, also in universities, there will often be kind of a counseling center as well too. And that's a really key time for people where those stressors will start to kind of show, and some of the illnesses start to show. And so in universities, there'll be a counseling center. If you live in residence, you'll have your university dawn or residence dawn, residence life people. And so, those are key people. Carrie, I know you're with Kids Help Phone, and I often think it's a really overlooked resource. And someone who works in an emergency department, a psychiatry emergency department, sometimes part of that safety planning is, I know you don't trust me. I know you're out there and you feel like you're alone, but I know that you want to talk to someone. Kids Help Phone is incredible. I mean, I am watching you and I see your compassion, and I can imagine how you've trained so many people to answer that call and just be there. And sometimes people need someone to just be there. We're all here because of Lumino Health, and Lumino's got great resources. And so, those are a few places to start. That's a bit of what support looks like.
Amazing. Thank you for that. I'm hearing there's community-based organizations and supports. There's also the professional ones as well. Absolutely. Okay. And so we've got one more quick question here. Some people might feel embarrassed or ashamed or even too proud to reach out for support. I'm curious, what would you suggest or say to someone who's feeling any one of those things?
I mean, I don't have a single answer or a single thing to say. For me, that would be a conversation. What are you worried about? What's going on for you? Can I just be here with you? Would it help if I made a phone call? It's a hard spot to be in when you're trying to convince someone to go somewhere and they're resisting it, so desperately. There are a lot of reasons why we have stigma around mental health, why we ourselves feel shame. I've said this again and again on so many of these presentations. I'm sure I sound like a broken record, but this is illness. This is disease. You don't get blamed when your pancreas poops out and you've got diabetes and you need insulin when you're an 8-year-old. You don't get blamed if a cancer grows and you need to get treatment for it. But for some reason, that's not the case when it comes to mental illness. But these are illnesses. These are diseases. They are unique in their beauty and sometimes kind of torture in that they are in our minds, and we use our minds to kind of think about, cogitate, rationalize what's happening for us. And that's why I think we kind of end up in this spiral where we don't just go and say, I've got this tummy ache, fix it for me. I've got this worry, what can you do about it? But you are not weak. You are not. You were sick. And that's okay. And we'll do what we can to get you through it.
So important. Sick, not weak. Thank you so much, Dr. Chintoh. I really appreciate that. So helpful to kind of know a little bit more about how to reach out, what types of supports to look for. Thank you. All right. So while we're on the topic of supports, I'd like to highlight some useful resources that will help to better equip you to start a conversation about mental health and find support. I'd like to note that all of these resources will be shared by email 24 hours after the webinar. So first, I'd like to touch on CAMH's Game Changers for Mental Health resources. A great place to start is the conversation starters. And what these do is they provide question prompts on how to reach out, how to be supportive to loved ones, folks in your community, and how to get help from others. It starts with a conversation, right? As simple as that. For folks who are wanting to increase their knowledge or just have, kind of questions about mental health, there's also the CAMH Mental Health 101 courses. They're free, they're great. I know I've spent some time with them. Secondly, there's Kids Help Phone. We'd like to share this community support map. We get calls from young people all the time who are saying, you're the first person I've talked to. There's nobody I can turn to. And something that we can do in a counseling conversation is build a community support map for young folks. It's important for them to know that there are lots of safe groups and adults available to support them. Not everyone in the support map might be an obvious choice. It can be helpful to really get creative when you're thinking about who to put in your support map. Maybe it's your homeroom teacher. Maybe it's that super nice librarian. Maybe it's a babysitter, a friend's older sibling, or maybe it's Charlie, the dog next door, who happens to be a really good listener. So get creative with those community supports. We've also got some other community resources. Kids Help Phone has a search tool called Resources Around Me. It's super simple to use. You just enter your location, select the type of support you're looking for, and a list of community centers, health services, and helplines or live chat lines will populate. Some of them will be located in the community that you choose. Others will be located elsewhere, but will serve the community that you're in. All supports listed in Resources Around Me are either free or based on sliding scale for access. Finally, we have, if you're looking for finding individual mental health support, luminohealth.ca has a provider search tool where you can find and book appointments with mental health professionals. This includes psychologists, psychotherapists, social workers, and clinical counselors. It's as easy as one, searching by your location and the mental health professional you're looking for. Then you find a professional either by location, virtual appointments, next available time, cost, and ratings. There's lots of information there on the professional. And then the third step is booking the appointment. Super easy. Again, these will all be shared in the email that you'll be receiving after the webinar. All right. So now we've talked a little bit about resources. We're going to start the Q&A, invite all of our panelists to chime in. So we've got our first question here. I believe I'm going to invite Dr. Chintoh to answer first, but everybody feel free to chime in. And so the question is, as a parent, what can I do when my child refuses to get help? I'm at a loss.
So my compassion goes out to you. This is a question I get a lot, but it's a situation that I see a lot. Usually, in our emergency department, where a parent has kind of tricked their child to come in, and they are desperate for them to get some help, and the child is not seeing, is not knowing, and it's a difficult place for a parent to be in. If you get them through the doors of our hospital or any hospital, then that's success. But before you get there, sometimes you need to walk with them. You need to be in the space with them. I mean, there are so many different ways that illness can present, that people can need help, that I can't quite generalize. exactly what you do in those moments. If there are safety concerns, and when we say, or at least when I say safety, I mean around someone at risk of killing themselves, harming themselves, taking their own life, or harming others, then you can move. Then you can bring them straight to hospital, and we've got legal ways in place to help out. But most of our situations aren't that dire, and sometimes you need to walk alongside for a little while and help and hold the pain that they're experiencing until they're able to move with you to a place where they can get help.
Thank you, Dr. Chintoh. That sharing that space and being with them and sitting with them can be really difficult, but it's super important. To sort of start that conversation. I know that through my experience with Kids Help Phone, we also have parents who call Kids Help Phone with their young people and try and start a conversation that way. There's also some parents who will place Kids Help Phone's phone number somewhere where the young person will find it, in sort of planting the seed of there is somebody there who will talk to you, who will support you, who will not judge you, and who will be able to keep the space confidential and anonymous for you. So that can be a way as well. Anyone else have thoughts on how to support a child who may not recognize or may not feel willing to get support?
Sure, I could chime in there. Having been through it as most parents have, I guess. And there's a couple of things that I think of, particularly in an illness where you lack insight. In the early days before you've received treatment, you may not have insight into the fact that you are potentially ill. And it's helpful to maybe focus on, instead of saying there's something wrong with you, you need to get help, maybe focus on, you seem unhappy. You used to love going to school and now you don't. You used to really enjoy being with your friends and now you don't. I want to help find a way to bring that joy back to your life rather than talk about illness. So sort of focus on the changes that have happened and that you want to help that person feel better. I think that sometimes helps as a parent. And I think that, parents like to give advice. I'm like no other parent. And sometimes that's not entirely what's needed. Sometimes it's admitting your own humanity and saying, I'm sad because you're sad and I want to figure out how to help you. And we can do that together. I don't know what to do, but we can do it together. I also want to mention in terms of resources, because one of the things I do is I am co-chair of the Family Advisory Committee at CAMH, and the Office of Patient and Family Engagement often takes calls from parents with this question. So that's another resource for people. I know on the website there's a pamphlet on this specific thing, but that's another resource. I just want to mention the Office of Family Engagement, because this is a very common question. And I think, it's showing love and compassion. And we're going to do this together.
Thank you, Susan. Yeah, that connection and being in that space with that person. And also, I think there's something really nice about someone noticing changes and saying, like, I noticed that this is different for you. Yeah. We can tells folks that we're paying attention. Mikaela, did you want to add to that question at all?
Sure. Yeah. I mean, I would echo everything that Susan and Dr. Chintoh said. And I mean, I think also just reiterating, like, it's scary to get help. It's scary to walk through the doors. But you don't have to do it alone. I think that's the biggest thing. And not having to do it alone does not make you a burden, like, at all. And just reiterating that. And also, I think that you're all on the continuum together, that mental health continuum that Dr. Chintoh mentioned. Parents are on there with their kids. They're just maybe in different places at a certain point in time, and that's okay. And you lean on somebody maybe who's a little bit further towards one side of the continuum at any point in time. But it's all okay, and it doesn't make you weak or anything. So.
Amazing. Thank you for sharing, Mikaela. I think that's really important to recognize too. You're not alone. No one's alone in this. All right. So we'll move into the second question for folks. Is there a metaphor or an example you can share to explain the feeling of mental health struggles, for those, particularly for those who might not be understanding, for those who respond with things like it's all in your head or it will pass? I know we've talked a little bit about this, but if we could sort of talk a little bit more about what might be helpful to explain what it's like for folks.
I'm going to start here inappropriately because I think maybe the best answer will come from people who have experienced versus someone who always kind of sits in the position of directing. But what came to mind for me there is that frustration you feel when you're constantly having to tell I mean, it'll be fine. Just get up, just go to, like, that you can't understand why they can't respond to this in the same way that you are in your moment. I wonder if that might be how the individual who is suffering feels. Why can't you understand that I can't respond to this in the way that you want me to?
I would completely agree with that. And I think I can't imagine what that must feel like. I just can't imagine when you're suffering. And it's kind of like, if someone has an accident and breaks their leg and you tell them, well, I'm sure you can get up and walk, or, you're in pain and it's like, well, just, have some herbal tea and it will all feel better. I just can't imagine that frustration. I have not experienced it, as certainly my son and, probably maybe Mikaela, but in the sense of, I have experienced it as a mother in terms of the advice I get. So people saying to me like, well, maybe he just needs to go on a vegan diet, or maybe he needs to get more exercise. And I can tell you the frustration I feel with that is immense. So I can't imagine how heartbreaking and difficult it must be to hear that. So this is where I get back to education and understanding. I think everyone in society needs to make a little bit more effort to understand what it feels like, because having lived with someone who has experienced extreme discomfort through depression and psychosis, and you cannot tell them just feel better. It's impossible. The best thing to say is, I see you're in pain. I wish I could do something about it, and I will do something about it. Like I will try and find the solution with you. And I know, one of the things that I think helped for my son was acknowledging how much pain he was in, but also saying, this is going to get better, because it does get better with treatment. The problem, of course, is access and all those things we've talked about. But, this feels awful right now, but I promise you it will be getting better and we're going to find the help you need to make that happen.
Thank you, Susan. Mikaela, would you like to share too?
Sure. Yeah. And I'm trying to think of a good metaphor. And I'd honestly say, like, it's one of those things that doesn't have words. The isolation, the emptiness, and of course, I can only speak from kind of the perspective of depression and OCD. There are many other mental illnesses that you feel different things, but it's like a very unique kind of ache and pain that just makes you apathetic in a lot of ways towards life. That's a really scary place to be when you actually don't necessarily care about the next day. And I mean, I don't know if I have words really for what that feels like, but I just want to kind of reiterate that it exists very prominently for people who really struggle with this, and they're frustrated with the fact that the people around them can't see it, and also frustrated with themselves for not having words to be able to describe it. I think we think that our pain is invalid if we don't have words for it and we can't articulate it perfectly, and that's not true. So it doesn't need to have words for sure to be valid.
Absolutely. Your feelings are valid. And I think that you found some really good words to share with folks to illustrate what it was like for you just now. So thank you. Wow. Just like to recognize what's been shared here. And just wanted to say thank you so much, everyone, for being here. I'd like to thank our panelists, Mikaela and Susan, for sharing your inspiring stories of resilience, and being so open and honest with us tonight. Dr. Chintoh, I'd like to thank you for providing your professional perspective, and the tips and supports that are accessible for folks to improve mental well-being. To our audience, I hope that you found this event helpful and that you're feeling inspired to start conversations about mental health with family, with young people, friends, folks in your community. Thank you for being here tonight. Just a reminder, your feedback is super important. We couldn't do these webinars without your feedback. So please let us know what you think. And you can share your feedback in the survey that's going to follow. Next week, the webinar recording will be emailed and posted for folks. You'll also get some resources within the next 24 hours. I just wanted to say thank you again to our panelists, for folks who have joined us at home. Thank you for spending your evening with us. I appreciate the time and attention that you've shared with us today. Thank you so much for joining us. Goodbyes are always hard, but take good care. Bye. Thank you.